Good afternoon. I'm Enid Slack, and I'm the director of the Institute on Municipal Finance and Governance at the Munk School of Global Affairs and Public Policy at the University of Toronto. On behalf of the board and staff of IMFG, I'm delighted to welcome you to the 10th, yes, 10th annual IMFG City Manager's Address. Our session today is called How a Prescription for Supportive Housing Can Reduce Hallway Medicine and Why Every Government and Community Should Care. Our guest speaker is the City Manager of Toronto, Chris Murray. I would like to start with the land acknowledgement. We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional lands of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. I would like to thank the external funders of the Institute, Havana Capital, Maytree, the City of Toronto, the Region of Halton, and the Region of York. I would also like to thank our team at IMFG for organizing this event today, Thomas and Gally, and also Daria and Adam at the Munk School. If you are tweeting about this event, our hashtag is IMFG Talks, and our Twitter handle is @IMFG Toronto. Chris will be taking questions from the audience at the end of his presentation, so please use the Q&A function at the bottom of the Zoom screen to send in your questions. And you can do that at any point throughout this talk. As I mentioned, today's presentation is the 10th annual event with the City of Toronto Manager. And it's the 4th for Chris Murray, and it's the 2nd on Zoom. As you know, IMFG hosts this event every year to hear from the city manager about what's been happening at the city over the year, as well as telling us about future challenges and opportunities. I took a moment this week to look over the presentations of city managers over the last 10 years. You can also do that. You can find them all on our website. It's interesting to see the range of topics that have been covered over time. In the early years of this address, for example, city managers talked about strategic plans and fiscal constraints on the city. I can still remember the picture, you may remember it too, of an iceberg and a discussion about Toronto being on a fiscal cliff. More recently, Chris Murray has talked about the kind of city we are leaving for future generations. He's also talked about the need for partnerships within the region and building back better after the pandemic. Today, Chris is going to focus on supportive housing. How can we take a whole of community and whole of government approach to tackle the precursors of homelessness before the downstream consequences and costs multiply for all three orders of government? I'm pleased to welcome our moderator for this afternoon, Lori Spadorcia. Lori is Senior Vice President of Public Affairs and Partnerships and Chief Strategy Officer at CAMH. She has led the development of ambitious strategic plans to redefine health, placing mental health at the center of healthcare and including social determinants as key forces in the health and well-being of Canadians. Lori's going to make a few introductory remarks of her own, and then she'll introduce Chris Murray. Chris will speak for about 30 minutes, followed by a moderated discussion with Lori. As I mentioned, at the end of that, there will be time for audience questions. And now I'd like to welcome Lori Spadorcia.
Thank you, Enid. It's such a pleasure to moderate this, the 10th annual IMFG Toronto City Manager's Address. It's hard to believe we are nearing the end of 2021 and just about 2 years through a global pandemic. To say it's been an extraordinary couple of years is an understatement. The pandemic has brought so many issues to light, most of which have existed for a long time, coming to the fore as a number of crises collided. The gross inequities experienced by marginalized populations, the decades-long mental health crisis, the high needs for safe, supportive, and affordable housing, which we'll hear about today, an opioid crisis that has seen daily death rates outpace those due to COVID-19. the debate about what is a living wage, and the life-saving necessity of paid sick leave, the need for universal childcare, driving home that economic prosperity is the other side of the very same coin as health and social prosperity. And we saw clearly that our health and well-being can be impacted just as much by our postal code as by our genetic code. The foundation to all of this, of course, is the stark reality that we are all interconnected, locally and globally. During a time of unprecedented social isolation, we learned that community in itself is a social determinant of health. It's been a year and a half of important lessons, and we simply can't miss this opportunity to right some wrongs. A pandemic recovery must be an inclusive recovery. And if we're going to build back better, then we must build back better for everyone. The good news is that we need not invest our time in studies and reports. We know where the gaps are, and we know what needs to be done. The wait for supportive housing can be up to 7 years in the City of Toronto. It's estimated that over 30,000 new units of supportive housing are needed in Ontario over the next 10 years. Evidence-informed and cost-effective approaches like Housing First, as an example, have shown that when
I'm wondering if we could maybe, while we're waiting for Lori to come back, Chris, if you might want to just start your presentation.
Sure, that'd be fine with me.
Thank
So
you.
we can go to the first slide, that'd be great. So Enid, do you want me to start, or?
Yes, please, go ahead, Chris.
Okay, so I mean,
you.
first of all, I just want to thank everyone for taking the time out of their day to listen to this presentation and ask questions. And of course, I want to thank as well IMFG, and in particular Enid and Lori for being here today, and hopefully she gets connected back on. This is my fourth presentation, the second virtual. I am so hoping, for a whole bunch of obvious reasons, that next year we're able to do this all in person. And clearly all of this community in Toronto is working hard to try and get us back to some kind of situation where we can all be together. So I think we're all looking for that. So I won't read what my talk is all about. You can see it in front of you. And if we can, I'd like to go to the next slide, please. This is a quote from Dr. Kevin Smith, the President and CEO of the University Health Network. And as it reads, the highest 200 to 300 users of emergency room services, that's with over 75,000 visits per year, consume 30% of the resources. This quote from Kevin struck me as really one of the main reasons why we're having this talk today, and something that has certainly seized me in terms of what's important for us to think about and address where we are right now with respect to our community and as the pandemic ends. So I mean, clearly 20 months ago or thereabouts, when the first wave of COVID hit us, our goal was quite clear. And when I say our goal, I mean government as well as community. And that was really to save lives and to not overwhelm the healthcare system, and as quickly as we could return people's livelihoods. And so we worked in a fashion that I don't think I've ever seen as a city manager, and this is my 13th year. And so I would say this, I would say that we learned an awful lot about ourselves and what we're able to do, not just as City Hall, but as government and as a community. And so it just strikes me that this challenge that's in front of us, and this is for people who are experiencing varying degrees of homelessness, that the problem has gotten worse. And if we don't pay attention to it, it will continue to grow. But I must say, like COVID itself, this problem is extremely complex. And that, as Enid had pointed out in the very beginning, it does require a whole of government, whole of community approach if we're going to solve it. And I would say that it's very much like COVID itself. It will take that kind of collective effort if we're going to make any kind of inroads in helping people address homelessness and return to some life that they would want to live and that we want them to live. And go to the next slide, please. I think you can probably tell the building in the background is the old City Hall. This shot was taken in about 1918. It was right around the time of the Spanish flu. And the quote is from the then medical officer of health. And it speaks for itself, but it is homes we must give our people, not merely shelter. And so the challenges that the world was facing when that global pandemic had hit, and in particular in Toronto, you know, it speaks to the problem that I think we're all still trying to address. And we know, as it did 100 years ago, and it's done now yet again, it has preyed on COVID and the effects of COVID, not just on your own physical health, but the health of the economy and the community overall has preyed on the most vulnerable. Women in particular have experienced tremendous impact, as well as BIPOC peoples who were struggling before COVID and so struggled mightily as a result of COVID as well. Our economy has been ravaged. There's not much doubt about it, whether you're talking in the early days, the whole restaurant industry, travel industry, retail industry, entertainment industry, all the areas of business in this community that employs you know, hundreds of thousands of people, many of which struggle to make ends meet. And so, you know, I think it's important that you know, when we talk about supportive housing, I think we have to see it as a key component to our whole recovery and rebuild strategy, and more specifically, how housing and wraparound supports can benefit not just the people experiencing homelessness, but a number of major institutions that struggle when people find themselves without a home. We could, next slide, please. Well, what's a finance presentation without something to do with money? So as I think I said last year, and it's still the case this year, I think it's pretty much a city manager's worst nightmare when over 10% of their budget is in question. And as everyone knows, municipalities don't run deficits. And we have to, every year when we present to council a budget strategy, it has to be balanced. So we have a very clear idea of the revenues coming in and the expenses that are going to be addressed. And in 2021, our challenge was in the order of 1.596 billion, almost $1.6 billion. And so if it weren't for the federal and provincial government to backstop that challenge, and that challenge was driven by a number of factors, certainly lost transit revenue, as well as a shelter system, which had to be expanded and had to be operated, which drove up considerable costs, and all the other things that are related to COVID itself, all totaling almost $1.6 billion. And again, to applaud the federal and provincial government for coming to the aid of municipalities across the country, in particular the programs of safe restart agreements and reaching home, we are able to address that massive number. And we are, as I speak, able to account for 1.52 billion, falling just slightly short of our 1.6 billion, which thankfully there's still some time left in the year. We hope that we'll be able to address that. But the programs that the federal and provincial government put in place enabled us to invest a considerable amount of money, and I'll talk about this later on in the presentation, to start to develop the kind of supportive housing system that we need. So certainly monies to address, as I will call it, the bricks and mortar of the supportive housing system. And so by the end of 2022, as you see here, we will have almost 1,500 new supportive housing units in play, with many more coming in the years to follow. But I want to draw your attention to 2022. And for that matter, I could say 2023, 2024, and so on, because as the pandemic comes to a close, the effects on the economy will continue to linger. So we expect that without, again, support from our federal and provincial partners, we expect that we're going to be experiencing a pressure of $1.1 billion. So you can only imagine in an overall operating rate budget that totals about 14 billion, if we were unable to acquire yet again the support of upper levels of government, what kind of challenge I would have in trying to find $1.1 billion of expense and lost revenue. So there's no question the budget, which will be launched in January of 2022, there is an important assumption built into that budget, or will be built into that budget, that speaks to yet again support from our partners in both the federal and provincial government. So, and I say this because it's just so important, and I think people appreciate that. Before COVID, I mean, probably one of the top issues that my predecessor and his predecessor would have communicated is the need for long-term financial sustainability. But you can only imagine when you're in the midst of a COVID type economy, just how that does play havoc with your revenues. And so really important that we point this out. And I just want to point out as well, in 2021, that our shelter system, which is costing us this year $663 million. To put that in perspective, the year before, our shelter system cost us about 40% less. So a significant investment has been in shelters. And when I say that, I mean not just the facilities that people knew of before COVID, but also including hotels and motels that we've been leasing, and in order to accomplish the social separation or social distancing requirements that public health asks us to do. So if we can, I'd like to turn to the next slide, please. And just a few things I think really worth pointing out. Approximately 8,000 people are experiencing homelessness in our community. And about 77% of that 8,000 figure are experiencing what we would call chronic homelessness. And what that means is that they're homeless for a minimum of 6 months in a given year. And we know when you are homeless for that period of time, matters related to mental health and addictions, if you were fortunate to not have them, the longer you stay homeless or in the shelter system, your mental health and your addiction challenges really only go in one direction. We also know that of the population that is homeless, Indigenous and racialized individuals continue to be overrepresented. In the case of Indigenous people, about 15% of those homeless are Indigenous. And when we compare that to the population, Indigenous people in this community represent about 2% of our population. And those racialized, about 60% are homeless, compared to that in our community just to be slightly over 50%. And of course, I want to point out as well that in terms of those that are homeless, about approximately 90% were able to provide some form of shelter indoors. And of course, that means that the remainder 10% are living outdoors. And as we know, and we'll talk about later, encampments and people who find themselves living in the ravines and right-of-ways and other parts of our city. And so we know that 50% of the shelter users also have a mental health challenge of one form or another. So, I think it's important that, when we think of homelessness, that we do understand that we have many people who are without homes that are in the system, the shelter system, which, to be very clear, we do not, I don't think any of you would ever consider a shelter to be a home. And so it's incredibly important that we understand just who is being served by the shelter system and really where our focus needs to be. Next slide. I think a lot of what you see on the slide is probably intuitive to everyone in terms of what are the issues, the common issues that homeless people, especially those that are chronically homeless, face. So I'm not going to read them all, except I think many people understand that, of course, housing affordability is a massive problem. for those, as well as the mental health issues, substance abuse. And we have seen our statistics tell us very clearly that the frequency of people experiencing these issues, mental health and addiction, has grown. We see that in the service supports that we provide the city and how they've been utilized in a much more substantial fashion compared to where we were before COVID. So, I mean, there are a whole host of reasons why people find themselves experiencing homelessness. And so these become some of the problems that we clearly have to be focused on if we're going to address this challenge. Next slide, please. Just to put, the costs in perspective when one is experiencing homelessness. In terms of the cost in our shelter system, prior to COVID, because more people were living in closer proximity, the cost was in the order of about $3,400 per month. Of course, by maintaining separation, we've required more facilities in order to provide people shelter. That cost has grown by the number you can see in front of you. From a justice system perspective, it's about $4,900 per month when someone who is experiencing homelessness finds themselves involved in the justice system. And of course, hospitals, which is the most expensive form of housing, if you will, it's in the order of about $12,200. And of course, anyone who's experiencing homelessness could find themselves certainly in more than one of these situations. So therefore, to just provide them the bare minimum, the cost is quite substantial as compared, and there's studies that have done exactly this work, compared to what it would cost to put someone in an affordable unit. In this case, the average would be, or the monthly amount would be in the order of about $1,150. And then of course the wraparound supports, and again, they'll vary depending on the individual, but somewhere in the order of about $2,000 a month. Now, having said all this, what you don't see here, and again, it becomes the challenge of people who are struggling in our community, that there's other services that are impacted clearly. So policing, fire, ambulance, all of those services, which we haven't added here, there are costs associated with that. So again, it's just really to put in perspective, what happens if you don't have a proactive approach to supportive housing, and imagine what these numbers might be like, say in 10 years from now, if we just continue with a version of status quo and we don't start to really address the fundamental issue that's in front of us. Next slide. And I think, as Lori was saying, it's not like we don't know the answer. So, I think it's really important, and I'll draw your attention to some work that was done in 2014 by Health Canada through the Mental Health Commission of Canada. And they were looking at the effectiveness of what is called the housing first approach. And basically, the idea here is someone who's experiencing homelessness, that we get them into a home as quick as possible, without a lot of steps or a lot of barriers to have to get through, but to get them into a place where they can be safe, they can lock a door, and they can begin the recovery. And so that study that was done back in 2014 looked at a population of people experiencing homelessness that were substantially or chronically homeless. So about 93% of that population was somewhere between 5 and 6 years homeless. And so the approach was, as I say, to adopt a housing first with wraparound supports. And that what they found after 2 years was that of that population of people that were subject to the housing first approach, that 80% maintained housing. Which for a population of people that are as challenged as they are experiencing that much homelessness and those issues, be it mental health and addictions, there was a pretty profound conclusion, I think, that came from that study, which we don't have to keep repeating. We don't have to keep piloting. The model is pretty clear that, and for those that are high needs, that a 10% investment would yield 15 or a $10 investment, excuse me, would yield a $15 savings. And so, again, in some respects, it's almost too bad that we have to argue it strictly on a business case or on a money argument, because there's a moral reason why we should be focused on helping people that experience homelessness. But there is, I think, evidence to suggest that by providing housing and providing wraparound supports, that you're able to help people before they need other forms of help, as I talked about previously. So if we can go to the next slide. So as mentioned by Eden, the whole of government, whole of community approach, which was articulated last summer when the city put together the Recovery and Rebuild report, which identified about 83 different actions, of which one of the main areas of focus was social determinants of health. You can see the housing system actors that really need to come together. And I just want to draw your attention to municipalities and the GTHA. I think it's going to be really important as we embark on this work that Toronto not see itself as alone, because as I think I've talked before about the fact that we exist in a very large economic region, I would suggest that the approach needs to include those within the GTHA. And thankfully, for the last year, the GTHA city managers and CAOs have been working together on a number of different fronts, one of them including housing. So I think it's going to take that kind of regional approach to do justice to this topic, as well as, of course, all the other groups that you see here. I know we've mentioned governments, but certainly our health partners, our housing partners, and not-for-profits, our community, our neighbors. But, you know, and all of us together, focusing on the homeless themselves. They are the most critical part of the equation. And I think it's, as the saying goes, it's never about us without us. And so I think it's going to be critically important that our eye be on those that are experiencing homelessness in order to tailor something that is going to best meet their needs. Next slide, please. I should mention that prior to becoming a city manager, first in Hamilton and now in Toronto, I did spend a few years as housing director and CEO of City Housing Hamilton. So I was able to see firsthand in that role what happens when people experience homelessness, and what are some of the methods that you can employ or you can apply to address the challenge, such as Housing First. But also as a CEO of a housing authority, you can see firsthand the real gaps in the system. And so this slide here, you know, I think it's really important that people understand what the roles and responsibilities at each level of government are, because if you look at it, the government of Canada, in many ways, is a massive funder of the housing challenge, and certainly is there to fund health and mental health, as well as set a framework for the provinces to adhere to. And it's not to say that the province doesn't invest money, of course it does, but it really has the accountability for implementing what the federal government requires it to do. And then, of course, the municipality in Ontario, which is unique compared to other provinces, where the housing, the actual bricks and mortar building housing is in the hands of the municipality. We have other responsibilities that affect, you know, a person's homelessness or ability to get out of homelessness. And so in some respects, you know, the federal government has the money, the province of Ontario has the accountability, and the city has the challenge. I don't always find that people appreciate what each government, level of government, is really responsible for, because I think oftentimes people think it's the city, City Hall in particular, that has all the answers. And quite frankly, we play a role, we play an important role. We are an important part of any table that is going to be set that's going to address supportive housing, but we're clearly not the only player. And, you know, and I would say equally important is the role of the not-for-profit organizations that help deliver the services that are critically important, as well as the healthcare institutions, certainly the one that Lori belongs to, And there are others I think are incredibly important in this discussion. If we can go to the next slide, please. Certainly, supportive housing has to be an integrated systems approach. So notwithstanding what the levels of government are responsible for, the individual themselves, each one will be unique. Their needs will be varied. But one of the things I find really important is that in bringing services to someone when they're ready to partake and to support themselves, is that the services themselves sometimes have to be brought directly to the individual. They can't always be expected to, attend across town, if you will, a facility where that service might be provided. So the adaptability of delivering services, I think, is going to be becoming increasingly important. And we have many groups that are on the ground that are able to mobilize and move to where they have to move to help the person that with whatever the particular matter is that they need help with. So that adaptability, I think, is really important. But you can get a sense of the variation of requirements that are necessary for an individual to start to live that independent life that we'll all benefit from. And so with that, I think it's really important as well. And this is one of the great learnings, I think, that certainly came from COVID and the work that we had to do, certainly with the vaccine program. And let's face it, there are certain things that people trust government to do and some things they don't. And so what we learned quite quickly was that to the extent that we could get or have people, understand the importance of the vaccine and accept one, we found ourselves having to work more and more with those trusted organizations in the community that had a direct connection with people who had questions. And it was really through that approach of engaging the not-for-profit organizations and the community partners that we were able to achieve the kinds of successes that we've had in the vaccine program. And Toronto, as you well know, internationally is one of the most successful urban municipalities when it comes to the vaccine. And so a lot of that comes from accepting the fact that, sometimes we need help and we need the help of those in the community, whether they be Indigenous groups that have tremendous trust and respect from the Indigenous population or other groups. We have to work hand in glove with them and not expect that just because we show up that people are going to agree with whatever it is that we have to offer. So I think that's incredibly important in any system. And of course, we talked from the outset, and we have talked last year as well about the importance of equity and reconciliation. Again, I think, if we're going to prosper in this community, those that are most vulnerable need to be treated with the respect and dignity that any one of us would expect. And how we approach them, I think, and the success that will occur will really depend on how interested and how committed we are to helping people succeed and not just ignore their symptoms and their challenges. So we can, I think, learn from past mistakes, and I think we can learn how to innovate together so that we produce the kind of outcomes that are going to be critical for the individuals that we want to help. Next slide, please. It would be irresponsible of me not to point out that the City of Toronto has, over the last few years for certain, been completely committed to trying to do everything it can within its powers, within its responsibility to address not only the affordable housing challenge overall, which in the case of Toronto, our housing strategy is quite clear. It's 40,000 affordable rental units over the next 10 years, of which 18,000 are meant to be earmarked for supportive. And we have on top of that a number of other strategies with funding initiatives attached. So certainly the poverty reduction strategy, Toronto Overdose Action Plan. But one I want to really point out, I think that people may remember and may not, is that early in the term, council decided to create a city building fund, which adds from the period of 2020 to 2025, 1.5% on top of the inflationary tax increase that typically occurs each year. So that 1.5% will generate $7.3 billion. That $7.3 billion is meant to address really two fundamental interests of the city. Transit, and by transit I mean the state of good repair of a transit system that is valued in the order of about $33 billion. That's how much money that we have to invest in our transit system. We want to maintain what we own. But also part of that money, and that isn't to say that we won't leverage, as we have been doing, upper levels government to assist in that extraordinary cost, but also that money is there as well to help with respect to the housing that needs to be built. So not just in terms of tax dollars, but also we provide city-owned land to support our housing interest, as well as a planning process that really is meant to streamline those that are making application to build affordable housing, that we get that work done as quick as we can. It's a program called Concept to Keys. We've also, as you saw at our last council meeting, passed into law our ability to provide housing through inclusionary zoning, as well as we have other strategies such as the Toronto Indigenous Health Strategy, and as well as our Toronto TO Action Plan. And of course, and those that know the work of Denise Campbell, Safe TO, which is another way in which we are addressing service delivery in this community to help people in our vulnerable neighborhoods. So there is a tremendous amount of not just strategy, but critical investment that's going to help, build more affordable housing, but also help with our ability to help people day to day live lives that are much more successful. But none of this can really happen without the support of the upper levels of government. Next slide, please. I just want to draw a little bit of attention to a partnership that was formed a couple of years ago between United Way, University Health Network, and the City of Toronto. And this is where we are taking funds that we receive from the federal government to build modular supportive housing on lands owned by UHN. And it's the three partners are embarked on a program that's very unique in Canada, where a hospital is working with a not-for-profit organization or funds not-for-profit organizations and the city. And so we have, as a start, 51 modular housing units that are being put in place and will be made live in 2022. And so it's this kind of, I would say, interesting, innovative kind of relationship that we need to grow. And again, it's not a matter of finding the right model, it's really a matter of scale. But I think the institutions here that I just mentioned, and the fact that they're working in the manner in which they are, I think points us in the right direction. Next slide, please. Our aspiration isn't unique in the sense that Toronto is the only one looking at this. That's not the case at all. I work with 5 other major cities in this country, Vancouver, Calgary, Edmonton, Montreal, Ottawa, and each has got their own strategy. But I found this recently to kind of really sum up, I think, in many respects, the challenge that I'm talking about here today. And this is coming out of the city of Victoria for the capital region. And this program that they are putting into motion, and the 4 components that I'm going to talk about right now, I think kind of sum up in many respects what we're trying to do. First of all, that as pointed out here, in resolving any housing crisis, you have to realign policies and programs at all levels, and they have to be realigned following the basic principle of the human right to housing. So I know the federal government has made clear its understanding of the concept of human rights, which of course the United Nations had talked about and passed into law a long time ago. And the City of Toronto certainly has done similar as the federal government has in terms of expressing housing as a human right. So I think when you apply that lens to our policies and programs, and you ask yourself the question, do they in fact lead to housing as a human right, you can start to get at least policy and program alignment. And then I think, as we've been talking all along in this presentation, you need a full-scale transformation of the homeless serving system. And so again, it is the whole of community, whole of government approach. The third point I think is really important as well. And that is to, really to me, when I look at this, it's to be clear on the outcomes that you're trying to achieve, but equally important to establish standards and to make sure that the accountability mechanisms are in place. And so I would think any system of the kind that I'm describing would require someone to evaluate whether or not the critical investments that are being made on an individual by individual basis is working. And so this is where organizations or institutions like the Dalalana School, together with our public health officials, could play a very important role into establishing whether or not we're achieving what we hoped and expect to achieve. And of course, engaging the people experiencing homelessness as equal partners. And I will say this, as a housing director and a former CEO, I was familiar with a program that was launched in Hamilton. And it involved a number of individuals that were frequently visiting the ER rooms in our hospital system there, who had severe alcoholism. And when you understood the lives of each of these gentlemen, you understood just how complex their issues were. And there was a purpose-built place for them that was designed to not just help them deal with their day-to-day challenges, which was all supervised by professional healthcare people, that they, over time, were able to start to regain some of their dignity. And I just remember one gentleman who was originally from Newfoundland had reconnected with his family. And the question that was asked of him was, what did you make of this program? And his comment was this. He said, I used to go to bed at night. Whether I fell asleep or I blacked out, my hope was that I would never wake up. He says, but since I've been here and I've been able to reconnect with some of my family in Newfoundland, he says, I look forward to waking up. And I think it's those victories. So it's not just the money that might be saved or avoided, costs that might be avoided in the system. It's really about those individual success stories that I think keeps everyone involved in a program like this going. So I think very much Victoria is identifying something that the rest of us are identifying, and that is the need for systemic change. And I would say coming out of COVID, we've had a lot of experience at working fast, working together, working well, and achieving some incredible outcomes. So we can go to the next slide, please. Whether it be the stories that you're going to read through the internet or statements that are made by political leaders, as pointed out here, Mayor Tory has not just communicated directly with the federal and provincial government about the need for not just housing dollars to build more housing, but also to get the support dollars that are necessary to try and keep our supportive housing program moving in the right direction. I think the mayor, Deputy Mayor Bailão, and all other members of Hamilton Council, I think, get it. They have certainly approved the plans that give us a clear direction on the actions that we need to take, and they have made the critical investments. I think we're at a point now where it's really about, and it's good that the throne speech that we've just heard, I believe today, did mention housing in particular. I would hope that the time would be now that we could adapt to more of a systems approach. I don't think we need more pilots. I think we just need to take the models that we know that work and scale them appropriately. Do it not just here in Toronto, but do it within the region that is generating a lot of the GDP in this country, and is, I think, very much deserving of a critical investment and a critical systems overhaul. So with that, we can go to our last slide. So with anything as important as this, whether it be, save lives, save the healthcare system, I would suggest that, it's not audacious at all for us to imagine Toronto is the first major city in North America to end chronic homelessness. I just think it's a matter of will, because the way has already been pointed out. With that, I just want to thank everyone for listening, and Laurie, I look forward to your comments and questions, and anyone else's. So again, thanks very much.
Thanks, Chris. I'm sorry that I left the conversation there for a little while. I've never been kicked out of a virtual room yet, but I think for me, that means we need to move back to in-person events. So that was the signal. But I did catch most of that, and I think I ended off my comments around the Housing First approach, and it was really great to hear you talk about that. I was actually going to end off my comments just talking about how we've come together during COVID, and you've talked a little bit about this. You know, I think we've proven during this time period that if we've got collaboration, you know, if we can look at collaboration, you know, instead of jurisdictional issues, and sort of galvanize resources and come together at different, you know, different levels of government and different aspects of community, we've certainly proven that we can face some pretty big challenges. So I hope that's what we're going to learn out of this, that we can solve some big problems. And actually, I was looking at some old press clippings where you were quoted, Chris, and you said that you said something like, "I'm not, you know, to be honest, I just love to solve problems, big problems." And so here you are, putting all these big problems on the table. I would say, you know, talking about the supports, the wraparound supports would be, you know, really critical. So we've got all these models, we've got, you know, we've got the studies, we've got proof. We do have to ensure that we stick to the fidelity, like we meet that fidelity to the models. And, you know, I know from my experience being in a mental health care facility, we have sometimes, you know, at some of our worst times, we've got alternate level of care patients. So the translation there is people who don't need a hospital bed, but there's nowhere else for them to go. At certain points in time, our rate is 1 in 5 of our patients, where there just isn't somewhere for them, somewhere safe for them to go. And, you know, so looking at your cost slide there, you know, that becomes really challenging. It also blocks up, you know, space and care for others who might need that care urgently. So it really is something that we have to come together on. I know that there are lots of questions starting to pop up, so I'm gonna start. You mentioned the throne speech. So let's start there. I don't know if you had a chance to look at it, but essentially what they announced today, or what they said they were going to, was a commitment to a housing accelerator fund. So I just thought I'd start off by saying, you know, this is specifically, the wording was to help municipalities build more and better housing faster. So just wanted to get your overall comments to start us off on what you think about the federal commitment. Obviously, the devil's in the details, but this was specifically in, you know, in the throne speech today, and just wanted to start off with that.
So thanks, Lori. First of all, it's a $4 billion fund. Details of that program are being worked out, but I think the incredibly positive news is that, you know, organizations like, you know, the Federation of Canadian Municipalities, so FCM, as well as the tables that I sit at, both nationally and regionally, that there's an interest in gathering from us and from our housing experts, like Abby Bond, what has worked and what hasn't worked, so that whatever comes up in the way of a program, to move as much money as quickly as we can into building the kind of housing that is in tremendous need. We're being asked that question right now. You know, I think they want to get it right. We can't applaud it loudly enough. So we certainly, we see an opportunity to in scale, add, you know, a tremendous number of units. The other thing I got to tell you, I mean, we're fortunate in the sense that there's so much money being spent right now on transit. So imagine that we could do affordable housing in conjunction with transit investments. So the idea of transit-oriented communities that you know, have all amenities in close proximity, but also allow people that you know, that will never and don't ever want to afford a car that they can access the transit system to do their, to do the things they do in their daily life. So, so we are very much aware of the program that's evolving, and I think it's very positive that we're being consulted. We're in the same business as they are. They want to see housing built, and we can be very good at building it.
That's great, thanks. I wanted to talk a little bit about sort of the whole of government and whole of community approach and dig a little deeper there. There's so much work going on around integrated systems. It seems to be kind of the policy thing du jour at this point. And I think that's, it sounds really good, and people working together is what we need. I want to talk a little bit about practically how that works, because, in one of the charts you had, if you look at sort of the different systems that need to come together, they all have different bosses or different funding arms or different jurisdictions, or, or leaning on philanthropy, for instance. Like, there's a lot of different what ifs there. And working across government and those deep silos is really difficult. So even within one level of government, it can be quite difficult to kind of break down those silos and achieve that integrated system. Do you have any advice or examples of how we can do that? Because I think, it's absolutely the right thing to do for those of us who have been trying to push for integrated systems. The barriers have been quite immense. So just wanted to get your views on that.
It's such a good question. And, there's no real simple answer. I mean, it's a lot of it has to do with the individuals that are brought into the discussion, and who do they represent, and what outcomes are we agreeing on as a collective. But you talk about breaking down barriers. The city of Toronto delivers 155 different services, and those services are delivered through 44 program areas. So I just had the laugh years ago when before I was ever a city manager anywhere, I attended a meeting in Toronto, and one of the senior administrators at that meeting referred to Toronto, which is not unique to Toronto. Let me just tell you that it's typical of all municipalities, but he referred to it as a loose association of warring tribes. And I wrote it down. It was such a great comment. And there's a certain amount of truth to that, but it's amazing when you start thinking about, we have a system in Toronto that we've been shepherding really for the last couple of years called results-based accountability, where we're looking at outcomes more so now than we ever had. And a lot of these outcomes, you will never achieve them without a number of different parties coming together and contributing what they can contribute to achieve those outcomes. And I think you need to tie money to outcomes. And so I think when you start thinking in that regard, so no longer is it good enough to talk about inputs and outputs. It's really about outcomes. And so when you think about ending chronic homelessness, if we all agree that we want to do that, think about what may result from that. I probably don't need a shelter system anywhere near as big as the one I have right now, right? And so, I mean, there's potentially a massive opportunity to avoid that cost and put some of that money into the system that we need to build. But again, I think it is, it's in part looking at, well, what if we don't do this? What do the future costs of policing, of fire, of ambulance, of shelters, if we just continue a status quo? So I got to tell you that, like, I am not convinced that what we're talking about is a whole bunch of new money. I'm not convinced of that at all. I honestly think there could very well be enough money in the system to do a lot of this. And so, it is about, I look at, it's not so much a defunding thing as it might be a detasking thing. Imagine that you don't have the hotel in a hospital, people that, should be, looked after in the community in proper housing with proper supports. So, I mean, you know, again, it's about what is the target you're aiming for? What is it that collectively we're trying to achieve? And none of us can, I mean, as much as I know, I've said that I love complex problems, I have never solved a single complex problem myself. It is impossible. But the fun of all of this, if you want to call it that, is the room that gets created, and room for everyone that has a hand in contributing to the solution. And that solution has to, that collection of solutions need to fundamentally address the outcome that we all share. And I think if you approach it that way, and I must say, you know, the Secretary of Cabinet that the province has just retained, you know, Michelle Demanuel, her background in Trillium, you would know her, others would know her. I mean, you know, they put some, you know, administrators in key positions that I think know how to partner and know how to have the conversations need to take place. So the Kevin Smiths and the Staney Browns and a lot of other people who I think institutionally are going to be important in this conversation, but equally important, the not-for-profit communities, you know, the ones that have the trust and have the ability to deliver. You know, it is a very large, complex collection, but I think the hope is, and not only, you know, to have an aspirational hope, but to put a timeline to it. If we're still talking about this 10 years from now, and we haven't made a material dent in this challenge, then I think it's to be held accountable at the end of the day.
So I'm with you on this being a fun, complex issue to tackle. I want to talk about two things that you talked about in that answer, and that's time and money. And you started to talk a little bit about defunding. So I'm just going to put it on the table. There, you know, the last couple of years, we've heard a lot about defunding police and moving those funds into, more of a prevention mode and other services. And you've made it quite clear through this presentation, what the payback investments would be. So I want to talk a little bit about, sort of rebalancing that money from intervention to prevention and how that there's a lot of politics and power around that. And I think that's going to be challenging. And then I want to talk a little bit about time, because you said if we're still here in 10 years, then that's not going to be a good thing. One of my personal views is that, that sort of keeps us away from this prevention mode is the ability to show those outcomes in a very nimble way. So all of these policymakers go to elections every 4 years, and they're making promises and they're reporting back to their electorates. That 4-year cycle is pretty quick, comes around pretty quickly. And some of these things need a little bit more time to prove, to document, to show the data, to get that outcome, versus an intervention like buying a hospital bed. So just wanted to kind of unpack that a little bit with you, both the complexities and politics of time and money and what you thought about that.
So you said an awful lot. So I'm going to start. I'm going to start in the very beginning, just so as we're really clear. I think anything to do with the police. I mean, first and foremost, the chief is someone that I think people should get to know and should get to understand his view. I am not of that mindset that it's about defund. That's not. I think at the end of the day, policing has got to be one of the most difficult services that anyone has to deliver, and it's open to endless amounts of criticism and oftentimes very little appreciation. And I look at what they do, what they wake up and do every day, and it is monumental. And I'm going to say this as well. I think a lot of the calls that they are expected to address, I think the chief would be the first one to say that their ability to address all those calls isn't anywhere near what what they can really do. In other words, if no one else is picking up you know, the challenge of someone who is, you know, experiencing, you know, a mental health issue or an addiction issue. You know, I mean, they are trained and skilled at very specific things within the policing realm. I think they would welcome, you know, the kind of support that I think they've been asking for years. So it's not, I know people will talk about this from a defunding perspective, and I think we should really talk about tasking. What tasks are they best equipped to address and are highly skilled at? And honestly, I think the other thing that we need to really remind ourselves that we are going to grow in the next 25 to 30 years in Toronto alone by almost 1 million people. So I don't know how you add almost 1 million people and not need to provide more service. You know, so this notion that, you know, the cost is just going to go down, even when you take some of these, you know, these challenging calls and have another group of people address them in other means and in other ways, you know, you're still going to have policing. I mean, the cost of a homicide to do all the research and carry it right through to a conclusion is, as I understand, in the millions. These are, you know, these are very sophisticated services that are done quite well by Toronto Police, and will not get cheaper as the days and weeks and months and years go on. You know, would they like to see others tackle some of these things and, you know, with the skills that they could bring to the table? I don't think they're disagreeing with that. So we have coming in the first quarter of next year, Denise Campbell and her team is coming in with an update on what it is that we can do. I mean, as I think people know, there are a number of pilots being tried in 2022 that are going to look at alternative ways of addressing these challenges. So, you know, there are always going to be people that are going to, and I understand the frustration, you know, speak in terms of defunding, but, you know, I think our police force has almost an impossible task, and you know, the things that they're incredibly good at are only going to grow in size and complexity. And so, you know, we're going to have to keep making sure that they're able to do their jobs well. You know, beyond that, I think I look at kind of where we're at right now, and I mean, you know, after every world pandemic, there's been a moment of taking a deep breath, and we're not returning back to where we were before as a society. So I really kind of look at, you know, this is really an opportunity for us to, you know, maybe, and I mean, my medical officer of health will love this, and we have a lot in common, to be quite honest, is that how you build and operate cities, I think, should be governed more by public health than it has ever in the past. And that could be everything from land use policies to programming to a number of things, because it's really keeping an eye on population health. You know, what makes it healthy, what makes it unhealthy, that I think is, you know, maybe a really important lesson for all of us to learn. My background is urban planning. I absolutely love how cities operate. I love how they're built. I just look at some of the evidence that's out there from public health in terms of the value of parks, you know, and what they can mean from a respiratory standpoint and other illnesses when they're properly located, properly sized, and properly designed. You know, placemaking is going to be massive in Toronto as we deal with people working from home. And so, you know, what will get them to want to come out, you know, and be together with other people? Well, making really interesting places. And we have phenomenal neighborhoods. We can make them even better. And so, you know, it is about understand the art and science of how you build and operate cities. I think that's going to be really important. And public health is so data driven. They have very good evidence as to what policies would make the most sense. And maybe I'll just end with, I was one of those transportation planners that when the big move came out and the medical officers all banded together to talk about the health benefits of having a regional transit system, I was very excited by that. I thought that was such a phenomenal statement. And so, you know, our public health officials can do more than vaccines. They can do more than inspect restaurants and keep us safe in that way. I think they can be equal partners in how we basically build and run cities.
Yeah, I hope one of the lessons that comes out of this, as you say, is the importance of public health and what that represents. I was actually speaking to your chief medical officer of health earlier today, and we were talking about exactly that, and kind of public health being at the center again, and what that means for investing upstream. I know that we've got some questions from the audience. I have one more that I just wanted to tackle, and you were sort of getting at it in this last question. I'm really excited and energized by the role that cities, that cities are playing. And you talked about some of those examples in your presentation. We've been looking at cities in other jurisdictions as well, like New York and Philadelphia, and right across this country, there are lots of examples of cities kind of taking the lead. And the city of Toronto, of course, we've had a Thrive table, a Thrive initiative going on with a number of partners collaborating from different sectors. So it's really helpful to see this taking place. I just wanted to ask you what you think about, this. Cities are actively leading the change. It is, they are closest to the populations. How does this play out in our federation? What will it take to scale and spread what's happening? Because certainly what we don't want is necessarily just a patchwork, and sharing that knowledge and ensuring that we're reporting on outcomes and sort of pushing across the country. What will it take to have to make this bigger and better?
Well, I mean, thanks again, Lori, for that question. I am by nature an interest-based negotiator. So, I'm not very positional. At the end of the day, I am keenly interested in the goals and objectives of others, whether it be other municipalities, other levels of government, not-for-profit organizations. What is it that they bring to the table that I need to understand as to how it's like a large puzzle, but with a very clear picture. How does those pieces fit together so that, we achieve something that is impressive? And so it's really, I think in part, it's first of all, cities, if we're going to wait for upper levels of government to magically come up with the answers, we're going to be waiting a long time. We would have had them by now. And so I think there's a responsibility that we have, but how we approach this, it's always in the how that really matters. I'm here to embarrass no one. I am here to ask good questions, though, every now and then, and see if we can't get some consensus on what it is collectively we're trying to achieve. But, I find, and probably one of the best living examples of this right now politically, honestly, because I've witnessed it, with my own eyes and ears, is Mayor Tory. It doesn't just magically happen that $1.5 billion appears. That is a result of relationships and ability to kind of understand respective interests and address those in important ways that we've been quite successful over the last couple of years. And of course, I'm not counting any eggs just yet in terms of 2022, but the mayor and his office and council have been quite effective, I think, in terms of the way that they've approached these massive problems with other levels of government, and the fact that they listen to each other. And not everything plays out in the public. I think there's conversations that are always going, very respectful, as I think people's impression of the mayor is. And that has served us very well. And the premier and the mayor, as you can imagine, have regular conversations, and they share the challenges that each one's facing, but they find ways to come up with good answers. So it's yes, it's complicated, but you have to have all the parties involved, and not every question or every comment, and the one that you haven't asked, and someone will, I'm sure, is about the encampments and the matter of the police, and why did that happen, and what did we learn from it? I mean, there's nothing wrong with people asking those really pointed, important questions as to, why do certain things evolve certain ways, and why did they not? and be prepared to answer that question. So, which I have no difficulty doing. I think it's important to have this kind of dialogue. Not everything is going to be, saccharine sweet.
Well, then that's a great entry point into some of the questions that that we have here. I agree with you. I think there's a little bit of art and science to this. Leadership truly does matter, and I think we've seen that in spades over the last few years. And I always like to talk about trust and how important that is, both in the relationships with stakeholders and also in the care and supports. The provider-client relationships are super important. So there's a lot that goes into that. You brought up the encampments. So let's talk about it. There is a question here around the costs associated with evicting the 60 people in the encampments, and what if we're going to talk about sort of where we want to put costs and on what side of the spectrum. The question speaks to the $2 million spent. Why did the city decide, evicting people from parks and destroying their belongings and forcing people back onto the streets was the most effective solution?
Well, I mean, it's always interesting the choice of words that people use to describe something, and so. The notion of evicting someone from a park would assume that you're evicting them from their home. Parks, as I think, not just our bylaws say, but the courts have proven, parks are meant for everyone. They're not meant for people to live in the manner in which the encampments have. And this notion that these encampments are safe and inviting and everything. It's, if you people that actually see it for themselves, and certainly we have, as part of our cleanup, have spent considerable amount of time and money addressing what are very challenging and unsafe places for people to be. Everyone's allowed to be in a park. It's just that living in parks that exclude the use of others is something that I think we set out in bylaw, and as I repeat again, I think the courts have spoken as to the legality of that. So notwithstanding, if you go back and look at 2020, we dealt with several hundred encampments, and a number of those individuals actually ended up in housing. I think the number is over 300, and certainly others ended up in shelters and ended up at hotels and motels that were leased. You'll recall in 2020 that there was no police intervention whatsoever. 2021 changed, and I think one of the things that's really important in terms of the role, of the police is that they're going to be present to support the city in the efforts to not just enforce the trespass notice, which was issued, but to ensure the safety of the city staff, as well as those experiencing homelessness in the public, in the park. So, and people may not want to hear that, but at the end of the day, I have a responsibility to the social workers that we hire, our streets to homes worker, who build relationships with individuals and try and help them into a place that is safer than the place that they are in these encampments, in these parks. And so, and again, there may be a lot of good intentions by individuals, but, I find it difficult when the work that our social workers are there to do is actively being, stopped and frustrated. That, how's that fair to the individuals that, people are committed to? So yes, absolutely. I mean, there was a need for support for those individuals that we hire to do important work. And certainly we have moved a lot of people out of the encampments into the shelter system, into housing, into the hotels and motels, to provide them something that is better than what it was that they had living in our parks and in our right of ways and our ravines. So I understand not everyone's going to agree with that. But at the end of the day, we have to view the matter of parks being there certainly for everyone. And the challenge that we're trying to address, we've invested heavily in providing those bricks and mortar supports that people need to, to be able to, sleep at night and not have to worry about, some of the challenges I think they were experiencing when they were living outdoors. Now, is that to say that the shelter system is perfect? It's not a home. I think I said that earlier. The shelter system, we did have some issues certainly with COVID in the shelters themselves, and what measures were being taken to address the COVID challenges, as well as just the overall safety of whether it be the hotels or shelters that we have. So I mean, we have a lot of supports in those facilities, and so they're not, again, homes, and they're not perfect. But our goal is to try and help people get on with the continuum of housing that they need to help themselves and their lives improve. And certainly, we've brought wherever we could some of the services that people need to help themselves. So, but again, I go back to the matter of policing and the support that police provide, certainly to our staff, and certainly to allow us to do our job and help people out of these encampments. So, we certainly had lots of success in 2020 without ever having to have that service there. But things changed in 2021, and I think we can all be on a better path. I think we all agree that housing first is the way to go, and we all agree that the supports that people need is where we should focus our energies and time. And maybe work together, and so I think that I think the challenges that we all faced, and I think the path that we're certainly experiencing now, in Dufferin Grove and other areas. I mean, I think we're again moving in the direction that we've always wanted to be in, and so that's really my answer.
Yeah, it's complicated. It's definitely a complicated issue, and I think it served as a symbol of sort of the lack of safe housing and safe and supportive housing that exists in the city. So the quicker that we can get to some of these plans, as someone who spent a lot of time in the mental health sector, we've talked a lot about how the default is to criminalize, and we just need to. We're starting to see some improvements, but we really need to steer that ship a different way for people's health and well-being.
But I think there's a couple of things that with rapid housing, and we were using Toronto Community Housing as one place for people to land, as well as the leased hotels and motels. I mean, again, I think we should be evaluating what worked and what didn't work. And I think there has been some successes, certainly, in those we were able to house. But again, and I know there's conversations going on right now between TCHC and the Dallin School as to how to evaluate the efforts that were made. So, I think we're all committed to doing the very best we can, and engaging those not-for-profit groups that are most effective on the ground. Certainly, there are many Indigenous groups that are quite critical to any success that we're going to have dealing with an overrepresented Indigenous population. So we want to work with them, support them in any way that we really can, and others that that we've had success with in the past. And I'm just going to say this, Lori, as well, that you mentioned the term relationship. I think we get it, that have been in this business for quite some time, working in various ways with people who struggle with challenges like homelessness. But and this is something that I really learned firsthand working with the Haudenosaunee out in Ohsweken, and in particular the Confederacy, when we were developing agreements with them, that they talked about what a relationship really ought to be. At first, it's grounded in respect. Secondly, it's developed through trust. Trust doesn't happen overnight. Trust is easy to lose, and then sometimes very difficult to build back. And then ultimately, in time, you may find yourself in some, higher level of relationship that might even look like, a partnership or a friendship, but, you can't assume it overnight. And I think we've been learning that through COVID in terms of how to work with populations and really take more of a community development approach and not just, assume that we have the right answers.
Yeah, and I really liked what you said during your presentation around sort of seeing the people, bringing the people who are experiencing these issues to the table, and having those conversations directly with them. I think we lose humanity in our policy responses when we don't actually talk to the people who are experiencing these issues that we're trying to tackle. So that also means building trust to have people around the table. We're just about out of time, but I feel compelled to tackle one more question, and we've only got a couple of minutes, but hopefully you've got a quick answer to this. What does your experience suggest in terms of housing density for vulnerable populations? Do high-rise buildings work, or do we need more lower density or mid-rise solutions as we create new housing?
Yeah, that's a great question. And, honestly, the needs of individuals experiencing homelessness are very unique. High density solutions don't always work all that well depending on the individual. So it's quite conceivable that low to moderate rise or medium rise development will work for certain people. Again, it's about, it's not a one size fits all, and it is really about tailoring the housing and all the supports that the individual needs, and realizing that, for anyone that has ever, I had an addiction early in my life. It was called smoking, and it was something that that is never, I could never really fix it once. It took me a fair bit of effort in order to kick it. Someone that has a very complicated set of issues, be it mental health and many different mental health challenges and addictions. And I don't need to tell you, Lori, you work in this field every day. It's one of those lifelong challenges for individuals. And I think society needs to find ways to address those challenges because it's never a straight line. And but certainly beginning with the right kind of housing for that individual, a housing selection that they make, a place where they want to be. I think that's really important to get on the path that I think, society and those individuals want to be on. So, so I wouldn't say it's just, no to high rise and yes to to mid rise. I think the assortment of answers have to be as varied as the people that we're going to try and serve.
Yeah, great answer. Choice is really important. So we've gone a little over time. I'm sorry, Enid. And I'm also just apologizing that I did somehow get kicked out there at the beginning. But this was such a great conversation. Thanks, Chris, for this. And I have to say, as someone who's in this sector and has been, and housing's been at the top of our advocacy list for the entire 15 years that I've been in this, it's really refreshing to have the city managers address completely focused on supportive housing. And you've got a partner in CAMH, and we're looking forward to making some much needed progress in this area. So over to you, Enid.
Great, thank you very much. I just need a couple of minutes to say thank you, so you haven't really gone over. Lori, you redeemed yourself. We're sorry we lost you at the beginning, but we got you back and you've done a great job moderating, so thank you. Chris, you really did tackle a complex problem this year, and we've had a far-ranging discussion. I think it's going to be solved by a whole lot of players, and I liked the way you talked about the role of the municipality, but in the context of all orders of government, community partners, health partners, and everybody else. Complex problems don't get solved by one level of government. We didn't get to all of the questions. There were some excellent questions, although many of them were about the encampments, so we did get to some of them. But we will pass the questions on to Chris and Lori. We collect them all and pass them on, and so they will be able to look at them. You said it was a complex problem, but both of you at some point said it was a fun problem. And I was happy to hear that, because if it's a fun problem, then both of you and others are going to stay involved for as long as it takes to fix this problem. So again, thank you, Chris. Thank you, Lori. We have the video of this event, which will be available on our website in the next few days. Chris's PowerPoint slides should be on our website tomorrow. Please share any of this with colleagues who couldn't attend today. Thank you to the audience for coming. Thank you for your questions, and I hope everyone has a great evening.